Medical billing for dentistry. You probably heard about the pros and cons, and mostly, I think this is going to get better. But so far, what I see in the dental industry right now, especially for dentists, providers, or dental office managers that don't really know this stuff or aren't, doing this on the day to day, it's this concept or this notion that we're doing something that is should be secretive or shameful in some way. And there's nothing farther from the truth. So in this video, we're going to be going over the dental medical integration fundamentals that every dentist, every office manager should know in the dental industry. My name is Eric Chong, and if you don't already know who I am the president of a company called One Med All. And we've folded that company and we were servicing dentists doing medical billing. And what we are launching is a dental medical integration company. And as we talk through this video, you will see exactly why we made that difference, why we closed that last company down, and why we are doing this new company and focused on dental medical integration. So let's go ahead and get right into it. When it comes to medical billing, you're going to see me replace that term more and more with medical integration. And the reason why is because dental medical integration, or the process of running your dental practice medically integrated, that's the day to day, and that's the main thing. It's saying the right things, it's communicating in the right way, it's talking to the patients and presenting cases in a way that everything is clear, everything is transparent, and you're communicating not just what the provider is able to do, but what the patient wants and needs. And this really changes the dynamic. It's not about dictating treatment. A lot of the practices that do it may have gotten by, but as we get into a future and as we get into a world with more choices, more doctors, and more available treatment options, it really does come to focus on the fundamentals, and the practice that do focus on how to do their practice or medical integration right, they really do strive and they do shine above the rest. And I think you're going to see why, because when it comes to dealing with patients in their mouth, you can call it dentistry, you can call it dental, you can call it oral health treatment, whatever you want to call it. I think we can all agree you can't have a healthy body without a healthy mouth. And if that's the case, then the medical needs of our mouth always come first, more than any other part of our body. It's not that you can only have mouth health or heart health or brain health. I'm not saying that, but I'm saying of all the areas of your body, it makes more sense that we take care of the mouth first, and the medical needs of the mouth must take priority over any dental, any optometry, or any of the other secondary or third issues. So I hope that makes sense. And as we make this shift into dental medical integration, I'm going to offer that it's a lot easier than you may think it is. And so just sit back, relax. You can pop some popcorn or take some notes if you want to. I'm going to try to keep this video as short as possible, but you need enough information to where it's not so simple you're left with questions. So we're going to cover the fundamental things that you absolutely need to know before you make that decision of whether you want to medically integrate your dental practice. Now, the first thing that I will say is when it comes to dentistry, when I first started this about 5 years ago, there was less than 1% of dentists that were even doing any form of integration in their practice. And there was less than 60% of them that were even actively billing or seeing patients, which means 0.6% of the 200,000 or so dentists all across the nation, they didn't even know this stuff, and they weren't even doing it accurately, properly, or completely. And that's where we come in. We are the leading training and educating company, and we've really pioneered. We've created a philosophy and a practice management system, and it's called Health Starts From Mouth. And we'll get more into that in other videos. And by the way, if you want to do medical billing, or if you're already in a dental practice, you definitely want to make sure to hit the like button or subscribe to this channel, because you may not see this video again. But when it comes to doing the medical integration at your practice or before you get started, there's a couple of things that you want to think about. And the biggest question that people have is this even legal? And is this even possible? Will I get paid? So let's address each of those questions. The first question is this legal? Not only is it legal, it's recommended. So when the COVID or the whole shutdown situation happened, if you remember, the ADA did what we thought they would never do. I think that's actually they shot themselves in the foot by asking dentists to shut down. I mean, imagine how, from the healthcare standpoint, from a systems view, how stupid that was and how much we wasted resources. Of course, dentists needed the days off and they could enjoy the days off and they deserved the days off. But what I meant to say is taking PPE equipment away from dentists, which is the first line of all of healthcare and it's the most effective provider, more so than any doctor. It doesn't matter if you do brain surgery or heart surgery. Even those MDs, they need another doctor to even read their own x-rays. Dentists are the only ones that can do the surgery, read their own x-rays, and diagnose. They literally are the superstar and the most, let's say, qualified or credentialed doctor of any of the specialties in all of healthcare. But still, they took the power away from dentists and they gave the PPE equipment and screening equipment to untrained professionals, volunteers, and people that just wanted to help. Now, that makes absolutely no sense to me, and we'll get to really why that happened and what we need to do to protect ourselves, not just as providers, but also as patients first, because we are all people too, and we want to stay healthy so that way we can do our job, whether it's in dentistry or the front office or, working with patients, or maybe we are a patient ourselves, and we all are, right? So the first thing is just understanding that it's not only legal, it's recommended. So during this time when everything was shut down, there was a very interesting experience that we had gone through. And while all the other practices were being asked to shut down, the ones that were dental only, elective only, all of the medically integrated dental practices or the dental practices that registered with CMS and said, oh, whoa, I'm not just a dentist, I'm a doctor of the mouth. I see patients for their medical needs. They not only were asked to stay open, they got paid to stay open. I mean, one of our doctors got paid a $90,000 check when COVID happened. And this is on top of all the PPE and all the other stuff. He didn't even have to really apply for it. When the shutdown happened, the HHS started paying doctors to stay open and to have the resources available to see these patients. It was an incredible thing, and it was a telltale sign. I mean, I can talk about how CMS wants dentists and doctors of dental surgery and doctors of dental medicine. I can talk about how they have it on the form, how it's legal, how they encourage dentists to sign up. But right now, with less than 3% of dentists that are currently credentialed or registered, there's still a lot of questions about whether, why that is and whether it's the right thing to do. And I can tell you it's absolutely the right thing to do if you're in the business of helping patients and making money for it. I mean, if you're running a nonprofit and a charity and you just want to do as much work as possible and give it away and you don't care about making money, you'd rather fundraise it all and get donations and sponsorships and beg for the money, then do it that way. But the right way, the correct way, the complete way to do it is to be medically integrated and to get paid for the doctor portion of the work that you're doing. So the first step, everybody knows, is to get an MPI. After you graduate from dental school, you get an MPI, you register with the state. Now, what all MDs do is they go through a residency program. That's when they're also credentialed, whether it's the hospital facility or some hospital group that they're working with. They're going to credential them also with the federal government. This lets the CMS, which is the Center for Medicare and Medicaid Services, regardless of whether you want to do business or want to see Medicare or Medicaid patients, you want to register with the federal government. And that's the 3-letter agency or the federal government agency that you register with as a provider in healthcare. Before you ever see patients, before you ever lay hands on a patient, you should register with the land that you're doing work on. And it's just simply a thing that a lot of dentists miss, and they get away with it because just most dentists are never taught. Now, as dentistry becomes more corporate, and as dentistry becomes more common, I think that we're going to see dentists becoming credentialed as a standard and as the first thing that they do at a dental school, just like the rest of doctors. But it's not like anybody's in trouble for this thing. In fact, a lot of dentists are not just losing out on money, they're losing out on patients. So it's really shooting ourselves in our own foot by not doing this stuff. And nobody's really to blame. Just the education wasn't out there, and that's why I'm making this video now. So let's go ahead and get into the next one. And the next question I get is, I think everybody knows not only is this legal, we've passed a lot of audits and we haven't paid a single penny back. And it's just like an IRS audit. It's not about proving the work that you've done. It's about having the records and documentation to defend or to be able to back up and to have records, receipts, proof of the work that you've done. And that's really what it's about. So when it comes to, doing the medical billing the right way, there's a couple of tips that I would have for you. And it's just to make sure that, number one, that you're credentialed. A lot of people try to send medical billing claims or expect to get paid on it without first doing the proper credentialing. And it makes sense why you're not getting paid. You're registered as just a dentist and you're not seen as a doctor of the mouth, as a provider, as an oral health care provider. And there's a difference. It sounds like a semantical one, but you have to register. You have to be on the playing field to play football. And in that same way, if you're not registered as a medical doctor of dentistry, then you're not going to get paid on any of the medical claims. So that's step one. Step two is we want to make sure that we have the proper training and the proper partners or the proper workers in place. And what I mean is there's a lot of dental practices that are getting in trouble because they're working with a medical biller that really doesn't know what they're doing. They're not licensed, they're not credentialed, maybe they've taken a course or two, and this is the most dangerous thing that we're seeing in the dental industry right now, is somebody or some practice thinking that they can send medical claims and do it at volume because they've taken a weekend course. Now, I'm all for taking a 2 or 3 day course and starting to bill claims. But if you don't have that support system, if you don't have a certified, trained, professional medical biller, then I wouldn't get started. And even then, the biggest question that I would want to ask with my medical integration consulting company or somebody that's helping my practice do medical integration is have you ever worked in a hospital? Or do you understand how hospital billing even works? And if they can't answer those two questions, they have absolutely no business doing the dental medical integration for you, let alone the medical billing. And the third question I'd probably ask the medical biller is do you have an intimate knowledge of dental surgery? Because that's really what it takes to become a health planner. And a health planner is a new phrase, a new name that we've coined, and it explains this much needed segment that we have or need in dentistry, but it's not really common. And a health planner is someone that is like an office manager. They know the front office and admin, but they also have to have an intimate knowledge of the back end. And is specifically not just understanding dental and medical treatment options, but being able to tie this all in to a treatment plan, or more importantly, a medical billing claim. So they have to have an understanding of medical billing and coding, or at least the basics of insurance and how the coordination of these benefits and what is the structure, what goes first and what goes second. But I'll give you a big hint. Medical, or the health of the patient, the beating heart, always comes first. The medical needs, when compared to any dental, vision, or any second or third needs. Of course, it's very important to see. It's even more important to be able to chew, to be able to eat your food and to not choke. But at the end of the day, if our heart isn't working, then we're not in a good place. But understanding that 70% of all heart disease and breast cancer starts from the mouth, and actually we're finding out that 90% of all of the things that a patient goes for to a hospital or to see a doctor for, 90% of those things can be alleviated, completely corrected, or even cured. And I know you're not supposed to say that word, but I'm just going to say that right now because we're here on YouTube or whatever channel that you're seeing this on. And it's the important thing is that you're able to help the patient get to a better place. And so when it comes to medical billing, I think you have an understanding now of, whether it's legal, how to get started in it and what are some of the most important things that you need to pay attention to. So, for example, when you get started, it's not just being credentialed. You want to make sure to have a medical biller or a staff that is trained in medical billing or has a support team that is properly licensed and credentialed. And the reason why I say that is with the experience, getting paid with medical billing is quite simple, especially once you get trained. I mean, hospitals do it and they have hundreds or thousands of patients a day. It can't be so hard and so confusing that it takes time like dental insurance does. I mean, dental insurance really gets away with all of their nightmares and their appeals and their resubmits because the medical billing isn't done correctly or the medical integration isn't done correctly. But if the medical billing or the medical portion of the claim already pays, it's a lot easier to submit that to dental insurance. And for lack of better words, strongly recommend that they pay because otherwise all you have to do is just send a legal letter with that medical documentation and they're pretty much required to pay. I haven't seen a single time where the medical claim pays and the dental won't. The dental always fights back because the medical part and the health part that we're supposed to do as healthcare providers was never done. So that's why they're fighting so much in dental. But I've seen from my experience, and I would like and I recommend you try this out for yourself. Once you start getting all the medical billing parts or the medically integration is done correctly, all of the dental has to pay. It's a second part of a primary procedure that already pays, and that's exactly how it works in Medicare. And so the third part of it is I just want to leave you with a little bit of tips and some experience that I had while going through this medical integration process. And a lot of people think before getting into medical billing that they want to do business with the commercial payers, but I think there's nothing farther from the truth. Especially as a dentist, and if you are doing a lot of surgery, if you like doing it and you're good at it, I think the prime ideal sweet spot to focus on as far as the patients go is that 65 and older category. It's not to say that you can't see patients that are underneath it. And sometimes Medicare, you'll see somebody that's 20 or 30 come in with chronic conditions and diseases that qualifies for Medicare. So it's not just 65 and older, but when they have these other issues going on, they usually have them because they need the root cause, which is a dental issue, treated, but either because of coverage, education, or just lack of this kind of knowledge being out there, they've been bounced around the healthcare system thinking that they need heart treatment, brain treatment, or something else. But it's your job as the primary care provider of their mouth to, when you see, you diagnose and you treat, or you offer to treat the situations and the medical conditions in their mouth. So that's what it's about. I hope that makes sense as far as what medical integration is, what it should even look like, and a little bit about what it wasn't or why a lot of these other practices were even getting into trouble with it. I mean, we've come such a far and long way, and I'll go more in depth to share the background and the story if you care to listen or learn. And that's what it's about, is we've learned a lot in this incredible journey. We started this off over 5 years ago after having done it for our own practices. And that's the biggest difference that I don't see in the medical billing space currently. And I don't think we'll see very much of moving forward, is a medical billing service and operation that is based on what we call health starts from mouth. It's a philosophy and it's a practice management system for dental practices to do medical integration. But if you don't have a system like this, there's a lot of other medical billing companies that have adopted it, that have copied it, and they're teaching it in their own way. But it starts here with me and my partner Mila. We're the ones that coined the term. I own the domain. We created the system, and before us, a lot of medical billing companies just didn't know what they were doing. They didn't do the compliance right. They didn't understand any of the regulatory requirements, and so they were winging it. A lot of the medical billing outfits, actually, there was about 7 different companies before we got started. They weren't even credentialed, and even now, most of them are not credentialed. So the first thing is just doing your due diligence, making sure you're working with a company or a medical biller or a medical integration coaching service, a course that actually knows what they're doing. And there's very few of these qualified people here in the US. So I'll leave you with that. Just remember that health starts from the mouth. The mouth is part of the body, and health is from head to toe. Remember, docs, dentists are doctors and dental is medical. So I appreciate you watching. Go ahead and like this video or leave any comments if you have any questions about this video or any content that you'd like me to cover in the future as it relates to dental medical integration. Thank you, and we'll see you on the next one.